to the station, Kentucky's conservative outpost. This is the anchor show for Kentucky's Voice, the Commonwealth's statewide conservative media outlet offering news and analysis from a conservative point of view. I'm Jim Waters. Thanks for joining us today. We've passed the halfway point of this year's General Assembly session, where more than, believe it or not, 1,100 bills have been filed. One of the 838 bills filed in the House of Representatives is House Bill 407, which is meant to address one of Kentucky's most serious problems, and it's a growing problem, that being a shortage of family physicians, especially in rural areas of the state, which are not only underserved, but have really, in many ways, many places become healthcare deserts. And we're joined today to talk about this by Dr. David McFadden, president of Eastern Kentucky University. We want to talk about an idea that his institution, a fine institution there in Richmond, Kentucky, has for tackling this problem. So welcome, Dr. McFadden. We appreciate you taking some time today to speak with us.
Absolutely, Jim. It's great to be on with you.
Well, Dr. McFadden, Kentucky, as I said there, especially in the rural areas, needs physicians. That's pretty obvious. And EKU has some ideas about how to fill those gaps. Tell us a little bit about this idea and the innovative approach you want to take to helping our state.
Absolutely. So House Bill 407 is a bill that was introduced in the House several weeks ago. Speaker Pro Tem David Mead is the bill sponsor. But this bill is geared toward providing some opportunity for a school like Eastern Kentucky University to bring the first public Doctor of Osteopathic medical school to Kentucky. As we continue to look across our counties where 94% of our communities are underserved or not served at all in primary care physicians, we see that there were over 13,000 applicants to the medical schools that are currently here in Kentucky, yet only 500 students got in. And we look at these healthcare deserts you were talking about, we realize that we need to increase the supply so that we can meet that demand. As a native Eastern Kentucky and a first-generation college student from a far Eastern Kentucky, my family, my friends, they live this every day. Getting access to good health care physicians who are available to see them is really a challenge.
Well, you talk about attracting people and jobs and opportunity to our state, but if we don't have healthcare providers, and considering really that 40% of our population live in rural areas, and certainly not that percentage of our physicians are there. So it all does impact. It's not, when we talk about this problem, we're talking about something that Kentucky really needs to address if it wants to become more competitive and if it wants to grow.
Yeah, and there's been a lot of conversation around higher education and the programs that are offered and where those programs are offered over the last decade. This notion of our ability not to offer a medical school or perhaps some other professional degrees was born out of the House Bill 1 in 1997. I think we're long past due to look at trying to think about what are the degrees, what are the professional practices that we need in this state in order to power our economy. In order to serve our constituents, to serve Kentuckians better. And so as we look at that, House Bill 407 is simply a bill that would remove that regulatory barrier that says a comprehensive university like EKU can't provide a school of medicine in order to meet this need. And so we're just hopeful that the legislature, the House, we're very thankful to them. This bill has passed the House 91-0. We're awaiting the opportunity to have a vote in Senate Education and hopefully get it to the Senate floor and wrap this up before the session is over so that we can get started on this work so that we can get these graduates out the door and serving in our communities.
Well, it certainly appears to have and does have strong support in certainly in the House and with Speaker Pro Tem David Mead, carrying the sponsorship on this, and then 39 co-sponsors, including Representative Mead, really, strong support there. What are you hearing in the Senate about this bill, Dr. McFadden? Is there? I know you're talking to senators, across the state, and especially from your region. What are you hearing about this?
Well, there's a lot of support. I think that as we look at the work that we're doing, everyone sees these healthcare deserts. They are representing constituents and communities that are underserved. So I think that we're seeing a lot of support in that way. I think that we're also seeing some conversations that are playing out about, how do we really support innovation and bold ideas? And I think this is kind of a new frontier for us in higher education. we have done the same things for so long. I think as we step out to do these new things, these bold things, these innovative things, our regulatory framework is just not supportive of that today. And so I think that for some, that they're all on board and they're ready to go. They're excited to see the marketplace kind of choose. I think that there's some who still maybe want to study these things a bit more and perhaps slow down just a bit. I'm hopeful that we don't take the slow down approach here in Kentucky. As a native Kentuckian, I think at times we've probably slowed down too much, and it's left us without some essential services. It's left us behind in a lot of ways, and we're playing catch up on a number of fronts. So I'm hopeful in this case we remove the regulatory barrier. We level the playing field. We let schools like EKU or Murray State or others who want to step out and do bold, innovative things do those things. And those things are going to be self-sustaining. They're going to be supported by those students who choose to come here and get a world-class education in a very affordable way.
Yeah, and I think, and certainly if that's a concern of legislators, speak to that for a moment about, so I think a lot of the coverage that we've seen of universities and higher ed especially during budget sessions has been, simply folks in Frankfort, asking for additional funding for various purposes, and certainly not all bad, and there is a need for funding, but this program is going to be self-sustaining. Talk a little bit about that and how that really should allay any fears about ongoing cost in future years, or is this going to be a program that the legislators have to figure out how to fund? That's not the case here. You simply want the opportunity to really put this into practice and just need to remove this barrier. That's all it is, really.
Yeah, I mean, I've talked to a number of operators of Dr. Osteopathic medical schools across the nation as they look at the work they're doing. That's high demand. It's the fastest growing sector of primary care physician training that's going on in the U.S. As we look from those institutions from Alabama to Louisiana to South Carolina to right here in Kentucky, what we see is that those are self-sustaining programs, that they stand on their own 2 feet, that the students who come and choose support that. But with an institution like EKU, with 150 years of educational opportunity being provided here in Kentucky, with strong enrollment and strong support from the administration, outstanding world-class faculty here, we are well positioned to do this. As we look at our different programs that we offer today, from our doctorate in nurse practitioner to our doctorate in psychology, we have a lot of the wraparound that you're going to see in that healthcare setting, that this is the next step. This is the next evolution in the work that we do. We've just got to remove this regulatory barrier that, frankly, harkens back to 1997. And I just feel like that if we look at the world today, we look at what we want from our higher education institutions today, it is materially changed during that time period. Yeah. And we need to make sure that our regulatory framework is reflective of the expectations that the public has for our universities to provide these opportunities.
Well, that's well said, and like we talked about previously that that there's been such change, and what you're really doing here is you're establishing your niche. You're finding a great need that needs to be met, and who better to do that especially for our Eastern Kentucky communities and our rural communities than EKU. So, there's been a lot of study done on this already, Dr. McFadden. I say this with all due respect. I don't think we need more study on this. I'll say that. I think what we need to do is get this implemented and talk about the timeline for this. If you are able to do this, when this would actually begin to make an impact on our state.
Yeah, for us, looking at kind of having that graduating class, if we start today, if we remove this regulatory barrier, move forward with the feasibility study, and secure all the pieces that are necessary, our hope would be to turn out our first class in the spring of 2032. This is a long-term investment. To see this through reality is going to require a commitment from the institution that is long-ranging. This is not short-term investment for short-term gain. It is truly a long-term solution for work that needs to go on here in Kentucky. Further, as I kind of think about this work, I look at the accreditation standards to become an accredited school in order to graduate that first graduating class. From financials to faculty to facilities, you have to check all the boxes before you can become an accredited program. So I don't think there's a need necessarily to study the study, but I think to finish the study and to move forward boldly, knowing that we're solving some of Kentucky's biggest problems.
defend democracy.
Misinformation poses a threat to our nation's health.
Climate change is an emergency.
Democratic socialism.
Codify women's right to choose.
Hell yes, we're going to take your AR-15.
Like EKU, with 150 years of educational opportunity being provided here in Kentucky, with strong enrollment and strong support from the administration, outstanding world-class faculty here, we are well positioned to do this. As we look at our different programs that we offer today, from our doctorate in nurse practitioner to our doctorate in psychology, we have a lot of the wraparound that you're going to see in that healthcare setting. That this is the next step. This is the next evolution in the work that we do. We've just got to remove this regulatory barrier that, frankly, harkens back to 1997. And I just feel like that if we look at the world today, we look at what we want from our higher education institutions today, it has materially changed during that time period. Yeah. And we need to make sure that our regulatory framework is reflective of the expectations that the public has for our universities to provide these opportunities.
Well, that's well said. And like, we talked about previously that, that there's been such change, and what you're really doing here is you're establishing your niche. You're finding a great need that needs to be met, and who better to do that especially for our Eastern Kentucky communities and our rural communities than EKU. So, there's been a lot of study done on this already, Dr. McFadden. I say this with all due respect. I don't think we need more study on this. I'll say that. I think what we need to do is get this implemented and talk about the timeline for this. If you are able to do this, when this would actually begin to make an impact on our state.
Yeah, for us, looking at kind of having that graduating class, if we start today, if we remove this regulatory barrier, move forward with the feasibility study, and secure all the pieces that are necessary, our hope would be to turn out our first class in the spring of 2032. This is a long-term investment. To see this through reality is going to require a commitment from the institution that is long-ranging. This is not short-term investment for short-term gain. It is truly a long-term solution for work that needs to go on here in Kentucky. Further, as I kind of think about this work, I look at the accreditation standards to become an accredited school in order to graduate that first graduating class. From financials to faculty to facilities, you have to check all the boxes before you can become an accredited program. So I don't think there's a need necessarily to study the study, but I think to finish the study and to move forward boldly, knowing that we're solving some of Kentucky's biggest problems. And
this is so badly needed in education, isn't it? I mean, students, and also this is an opportunity to attract students to the medical industry or field that may have thought they couldn't do it. You're going to make this affordable, and you're going to make this available. So, I hope that will help solve some of these other issues that we have in terms of numbers of physicians and that type of thing. Attracting students is important. Mm-hmm.
And that's been a focus of ours here at EKU. Affordability and access is key to us as we support first-generation students. Our freshman class this year, 50% of the freshman class were the first in their family to go to college. We have reduced cost of attendance at EKU over 5% over the last 4 years. We are leaning in to make college a degree, a profession, getting a job, a good-paying job, and staying right here in Kentucky more accessible and more affordable than ever. We're committed to doing that with the medical school proposal, and we're just hopeful that we can move forward, get House Bill 407 voted on in the Senate, get it approved, and be able to move forward this summer without having to worry about slowing down or perhaps having to do some additional work that is outside of a very rigorous accreditation process.
And that is costly to taxpayers. Let's just say all that does cost time and taxpayers. So, hey, it's just really refreshing, Dr. McFadden, to see this from our higher education institutions and to see this innovative thinking going on there at Eastern. I want to applaud you for this. And I want to encourage legislators to move forward with this so that our whole state will benefit, especially our rural areas and our underserved areas. So thank you very much. And we appreciate your time today and hope to have you on again. Hope you'll come back on and keep us updated on how this is going.
Absolutely. We'll keep working, and we appreciate the support.
Well, thank you, and stay with us here on the station, Kentucky's Conservative Outpost. We'll have more about legislation going on in Frankfort and the General Assembly coming up. Right on Crime, Kentucky's new Right on Crime Director, Joey Comley. Stay with us right here on the station.
We are here to defend democracy.
Misinformation poses a threat to our nation's health.
Climate change is an emergency.
Democratic socialism.
Codify women's right to choose.
Hell yes, we're going to take your AR-15.
Next on the program today, we're joined by Joey Comley, the new director at Kentucky Right on Crime. Joey has served as a judge advocate in the Army, and he's now opened his own practice there in Elizabethtown that specializes in representing members of the military in criminal cases. But for our purposes today, we want to talk to him about his work with the Kentucky chapter on Right to Crime. And Joey, we can talk about anything you want to, but we'll start there anyhow. But welcome to the program today. Right on Crime, tell us a little bit about it.
So first off, thanks for having me, Jim. It's my pleasure to be here as both a conservative and a Christian. Right on Crime is the criminal justice policy arm of the Texas Public Policy Foundation. So what we do at Right on Crime is we have 14 policy analysts, a lot of whom are also attorneys. They serve to inform legislative efforts in their respective states on criminal justice reform efforts. So we're guided by conservative principles in that we want to ensure that criminal justice reform is undertaken with the paramount goal of achieving and maintaining public safety while also preserving individual liberty. And obviously, we want to ensure that those legislative efforts are informed by data and actual science, as opposed to the sometimes catastrophic consequences of criminal behavior that are very easy to sensationalize, but probably the wrong impetus in addressing such a complicated problem such as criminal activity and its impact on any state, much less a city or a municipality within that state. And then additionally, we serve to hold all of these reforms responsible from a fiscal standpoint, so that we're actually tracing and ensuring that states are getting a return on their investment in criminal justice reform.
Yeah, it's important. You know, it's important, isn't it, when it comes to criminal justice reform policy, as with all policy, I suppose. But I think especially with this, we see a lot of, we've seen in the past, Joey, a lot of well-intentioned policy proposals that have been based on emotion or on anecdotal narratives, and so how important is that, and how different is that to advance criminal reforms based on sound data, and then doesn't that have an impact on the way that resources can be effectively used to actually reduce crime?
Absolutely, Jim. I think what folks need to realize sometimes when they're dealing with criminal justice reform is that it's not a current General Assembly solution that's going to eradicate the plague that is criminal activity in any jurisdiction. It's just not going to happen. It's a very complicated. We're really talking about human behavior. So I don't know anything that's more complicated than that. You mentioned this is a conservative Christian outlet. We've got one book that we study incessantly that's aimed at driving human behavior. And that's from our Savior, right?
Yeah.
So,
Yeah.
I mean, it is a complicated problem to really identify and pinpoint. And I think it requires such diligence and such study that really any sort of wide-ranging omnibus criminal justice reform should never be the product of a single session of a General Assembly. I just don't think there's time for members who are not practitioners, members who haven't devoted their entire life to studying criminal justice or being involved in either corrections, law enforcement, or the prosecution or defense of individuals accused of criminal activity. I don't understand how those individuals can feel good about voting on criminal justice reform. State police post located in Louisville, which would enhance investigative, laboratory, and other investigative techniques utilized by the most professional law enforcement entity in the state of Kentucky, which is the Kentucky State Police. It would free up LMPD and other law enforcement agencies to hit the streets, to demonstrate a presence, to actually interdict crime before it takes place or right when it takes place, to be the arresting agency at the scene of the crime, to also establish a community presence such that community members in impoverished areas start to trust and interact with police in non-intrusive situations when they're walking down the street. I mean, we see beautiful videos all the time, right, Jim? You see a police officer on the beat, he's on patrol, he jumps out of his car and he plays a game of horse with a young man, right? Or a young boy, man in the making, in his driveway. I think that impact and that story told time and time again in the West End of Louisville makes Kentucky safe.
Well, when
And I
you
would
talk,
challenge anyone on that.
yeah, when you talk about resources too, it's important, isn't it, to make sure that we do have the resources for policies that actually will and have proven to keep us safer, like keeping violent criminals off the streets. If you throw away resources on things that don't work and things that won't reduce crime, then where are the resources needed to actually really make us safer?
Absolutely, Jim. And without even getting to the price tag on this bill, which I hope we'll discuss later, I would remind everyone that, I think it's the Bureau of Prisons from the Department of Justice has said time and time again, without challenge, and this is a 50-state tri-territory sort of analysis, but 95% of all individuals who are sent to jail or prison, so who are incarcerated, will one day be released. So let's just think for a minute. Those 95% of individuals who are locked up, do we want them to have access to reformative programs while they're in prison so that they can make a decision to address some of the impulsivity issues that might have led to their criminal conduct, that might be able to establish a different type of behavioral framework that might, God willing, like establish some values-based system in them as an individual, such that when they are released, they can not only find a job, but they can re-enter a household, be a contributing member, a positive influence on the people that they left behind, but then also extend that out to their neighborhood and their community. I think whenever we have a law, like House Bill 5, that takes away the ability for individuals in prison to access programs like that and to incentivize them to participate in those programs with the possibility of early release, I think what we're doing is we're generating an entire prison population that'll be released, 95% of them, who are either as violent as they were when they went in upon release, or they're made more violent because the only thing they're exposed to are not reformative programs, but they're the criminals that don't have a chance of ever leaving that place.
Well said. Well, we're out of time, Joey. I hope you will come back and we can talk about the fiscal impact of this when we, as we look and consider this very important issue, especially for our Louisville community here. So, Joey Comley, thank you very much. Thanks for joining us here on the station, Kentucky's conservative outpost, the anchor show for Kentucky's Voice, the statewide conservative media outlet in the Commonwealth, offering news and analysis from a conservative and Christian point of view. I'm Jim Waters.